You know that lab result you get from your doctor? It feels like the end of the story, but really, it's just the final chapter. And what if I told you that the most critical part of that story, the part where most mistakes happen, takes place long before your sample ever sees a fancy machine? Let's follow the journey.
Yeah, this quote really nails it. Quality results don't just magically appear. Nope, they are carefully built step by step, through a process that has to be just right from the very beginning. So what do you think? With all the high-tech, million-dollar analyzers in a modern lab, you'd assume the mistakes would come from the machines, right? Or maybe some complex chemical reaction. Well, the real answer is probably not what you're thinking.
That's it, right there. The overwhelming majority of lab errors happen in what's called the pre-analytical phase. And that's, well, it's everything that happens before the analysis, from the moment they call your name, to drawing the sample, to getting it safely over to the lab. It all starts with you.
So the whole journey kicks off the second a phlebotomist works up to you. But before they even think about a needle, the single most important step has to happen, making absolutely sure you are who you say you are. And look, this is so much more than just a formality. It's like a chain of evidence for your own health. If that very first link, your identity, is wrong, then every single thing that follows is useless or even dangerous. The draw, the test, the diagnosis, it would all be for the wrong person.
You know, there are these super strict rules from groups like the Joint Commission, and one of the biggest is the 2-identifier rule. But notice how it works. They don't ask, "Are you Jane Doe?" because it's too easy to just nod along. They'll ask you to actively state your full name and birthday. And for a kid, they'll ask the parent, "Can you please tell me your child's name?" It's a small tweak, but it makes a huge difference.
Okay, so they've confirmed it's you. Now comes the part everyone thinks about when they think of a blood test. And trust me, this is a highly skilled medical procedure. It takes a ton of precision and knowledge of human anatomy. So for most of us, this is the prime real estate, right in the crook of your elbow, the median cubital vein. It's usually pretty big, it doesn't roll around, and it's close to the surface. It's the perfect target. But finding it and getting a clean stick, that is a real skill.
And if you watch them, it's like a perfectly choreographed dance. Every step is deliberate. They clean the site with alcohol, and, this is important, they let it air dry. Wiping it off can actually mess things up. The tourniquet goes on just so, and it comes off the second they get good blood flow. It's all about precision.
Now that tourniquet, the timing on that thing is absolutely critical. There's a 1-minute rule. You leave it on any longer, and the pressure starts to squeeze the water out of your blood and into your tissues. That falsely concentrates everything else that's left behind, proteins, enzymes, you name it. That one simple rule prevents a whole bunch of bogus results.
All right, let's look at the tools of the trade. A phlebotomist has a few options, and they're not just picked at random. The standard setup is that vacuum tube system. But for someone with smaller or trickier veins, maybe a child or an older patient, they might use a butterfly needle or a syringe. Those give them much finer control over the pressure so the vein doesn't collapse.
And, drawing blood from a kid, that's a whole different ballgame. It takes a lot more than just technical ability. It's about being calm, quick, and safe. They use special holds, often with the parent helping out, to keep the child still and secure. It's all about getting it done safely for everyone.
Okay, the blood is flowing, mission accomplished, right? Well, not so fast. Where that blood goes next is incredibly important. Welcome to the surprisingly colorful and complex world of blood collection tubes. Come on, you've seen them, right? That little rainbow of caps on the tubes? Well, they're not just for decoration. Each color is a code, signaling a very specific recipe inside that tube designed for a very specific test. Think of this as your secret decoder ring for those colors. Light blue? That's got sodium citrate for checking how your blood clots. Gold or red is for general chemistry, things like your kidney function or electrolytes. Green has heparin, another anticoagulant. And that very common lavender top has an additive called EDTA, which is perfect for preserving your blood cells for a complete blood count. But wait, there's more. Just knowing the color isn't enough. The order you fill them in is just as critical. Seriously, it's all about preventing the additive from one tube from accidentally getting into the next one. And this is the sacred order of draw. It's like a recipe that has to be followed in the right order. You start with sterile tubes, then coagulation, then serum. Why? So you don't, for example, get a tiny bit of the potassium-rich EDTA from a lavender tube on the needle, which then contaminates the next tube and gives you a falsely and dangerously high potassium level. It matters. A lot. Okay, deep breath. The sample's collected, it's in the right tubes, in the right order. We're in the home stretch, right? Well, not quite. Now we face the final hurdles, handling and transport. This is where things can still go wrong. Well, this is where one of the biggest villains of the story can show up. It's called hemolysis. It's basically when red blood cells get damaged and burst open, spilling all their contents into the liquid part of the blood. This can happen from shaking a tube too hard or even from a really difficult draw.
And wow, just look at the difference here. On the left, that's what we want to see. Nice, clear, straw-colored plasma. But on the right, yikes, that sample is hemolyzed. The plasma is red because it's full of hemoglobin. But it's not just the color. Since red cells are packed with potassium and certain enzymes, a hemolyzed sample will give falsely high and clinically alarming results. It can totally change a patient's diagnosis.
So, to avoid that nightmare scenario, there's a final checklist of protective measures. You gently invert the tubes, never shake them. You separate the plasma from the cells within a couple of hours. You keep them at the right temperature. Every little thing is a checkpoint to make sure the sample that gets analyzed is a perfect snapshot of what's going on inside your body. You know, when you step back and look at it all, from your arm all the way to that analyzer, it becomes so clear. This isn't just a simple procedure. It's a meticulously controlled process where nothing is left to chance because your health is on the line. And that really brings us back to this idea. It's all about the people. The phlebotomists and the lab staff who handle these samples carry an incredible amount of responsibility on their shoulders. Their skill and their attention to detail are what make an accurate result possible.
So, I'll just leave you with this one question. After seeing this whole hidden journey, the next time you sit down to have your blood drawn, will you just see it as a quick poke in the arm, or will you see it for what it truly is, the critical, incredibly precise first step in your own medical story?